Ever wondered if liposuction could be the solution to your body contouring woes? Welcome to a world where modern medicine meets aesthetic aspirations. Liposuction, a popular cosmetic procedure, has been helping countless individuals achieve their desired body image. But what is liposuction, you ask? It's a surgical procedure designed to remove excess fat from specific areas of the body, be it the abdomen, thighs, buttocks, arms, or the neck. Remember, this isn't a weight loss solution but a technique to sculpt and contour your body to your liking. So if you've been trying to get rid of stubborn fat deposits resistant to diet and exercise, liposuction might just be the answer. But like any medical procedure, it's important to understand what it entails fully. From benefits and risks to the recovery process and cost, we'll cover it all. So, without further ado, let's dive into the most common questions about this intriguing procedure. So, what exactly are the benefits of liposuction? Well, liposuction can be a game changer for many people, providing a way to sculpt and contour the body for a more toned appearance. It's like having an artist's chisel, carving away the unwanted bulges and bumps that just won't budge, no matter how many salads you eat or miles you run. One of the major benefits of liposuction is its ability to target stubborn fat deposits. These are the areas of your body that seem immune to diet and exercise. You know the ones I'm talking about. The love handles, the double chin, that extra bit around the thighs. Liposuction can go into these areas and remove the fat cells, helping you achieve the body shape you've been working towards. Now, it's important to remember that liposuction is not a substitute for a healthy lifestyle. It's not a magic wand that can make excess weight disappear. But it can be a powerful tool in your body transformation journey, complementing your efforts in the gym and the kitchen. Another great thing about liposuction is that the results are long-lasting. Once those fat cells are removed, they're gone for good. So, if you maintain a healthy lifestyle post-procedure, you can expect to keep that newly sculpted body for the long haul. Now that we know the benefits, let's talk about how liposuction is performed. Are you curious about how liposuction is performed? Well, let's dive right into it. The process of liposuction begins with anesthesia. Depending on the extent of the procedure and the patient's comfort level, liposuction can be performed under general anesthesia or local anesthesia with sedation. Once the anesthesia has taken effect, the surgeon will then make small incisions in the targeted area. These incisions are typically only a few millimeters long and are placed in inconspicuous locations to minimize visible scarring. Next is the introduction of the cannula. This is a thin, hollow tube that is inserted through the incisions into the fat layer beneath the skin. The cannula is moved back and forth to loosen the fat cells, which are then suctioned out of the body. This process is repeated until the desired amount of fat has been removed. Now, it's important to understand that there are different techniques used in liposuction. Traditional liposuction or suction-assisted liposuction is the most common method and involves the use of a high-pressure vacuum to remove the fat. Then there's laser-assisted liposuction, which uses laser energy to liquefy the fat before it's suctioned out. This method can also help to stimulate collagen production, which can lead to tighter, smoother skin in the treated area. And lastly, we have ultrasound-assisted liposuction. This technique utilizes ultrasonic energy to break down and liquefy the fat, making it easier to remove. This method is particularly effective for treating larger areas or areas with denser fat. Each of these techniques has its own benefits and drawbacks, and the best method for you will depend on your individual needs and goals. Your surgeon will discuss these options with you and help you decide on the best approach. So, as you can see, liposuction is a highly customizable procedure that can be tailored to meet your specific body contouring goals. It's a meticulous process that requires surgical precision and an artistic eye to achieve the best possible results. With that in mind, let's move on to the recovery process. Recovery is a crucial part of any surgical procedure. And when it comes to liposuction, understanding the recovery process is key to achieving the best possible results. After liposuction, you can expect some downtime, usually lasting a few days to a week, depending on the extent of the procedure. This is a period when your body is healing and adjusting to the changes. During this time, it's advisable to take it easy and avoid strenuous activities. Now, let's talk about possible side effects. It's normal to experience some swelling, bruising, and discomfort in the areas treated. These side effects typically subside within a few weeks. Some patients may also notice a temporary change in the sensation of their skin, which usually resolves over time. Let's not forget about the importance of post-operative care. Following your surgeon's instructions is paramount to ensuring a smooth recovery. This includes taking prescribed medications, wearing compression garments, and attending all follow-up appointments. Hydration is also essential during recovery. Drinking plenty of fluids helps to flush out toxins from your body and promotes healing. And of course, maintaining a balanced diet can aid in your recovery as well. Remember, everyone heals at their own pace. Patience is key. It may take several months to see the final results of your liposuction procedure as your body needs time to adapt to its new contours. And let's not forget, physical recovery is just one aspect. It's also important to consider your emotional well-being. You might feel a range of emotions from excitement about your new look to anxiety about the healing process. It's completely normal. Reach out to your support system or a mental health professional if you need to talk. While recovery is important, it's also necessary to understand the possible risks and complications. Coming up in our next scene, we'll delve deeper into the potential risks of liposuction and how to minimize them. Stay tuned. Opening. Like any surgical procedure, liposuction has its risks. As we delve deeper into the world of liposuction, it's important to acknowledge that while it can provide significant benefits, it isn't without its potential pitfalls. As with any surgical procedure, there's always a degree of risk involved. One of the most common risks is infection. This can occur if bacteria enter the body during surgery, leading to symptoms such as redness, swelling, and fever. It's crucial to follow all post-operative care instructions to minimize this risk. Bleeding is another potential complication. Although rare, it can occur if a blood vessel is inadvertently damaged during the procedure. This is why it's so important to have a well-trained, experienced surgeon perform the operation. Anesthesia complications, while also rare, can occur. These can range from mild reactions like nausea and dizziness to more severe issues such as an allergic reaction or breathing difficulties. To mitigate this risk, a thorough pre-operative assessment is typically conducted to evaluate your overall health and suitability for anesthesia. There's also the risk of dissatisfaction with the cosmetic results. This could be due to uneven fat removal, dimpling, or changes in skin sensation. It's essential to have a clear understanding of what liposuction can and cannot achieve, and to maintain realistic expectations. And let's not forget, there could be psychological impacts too. The changes to your body might take some getting used to, and some people might experience a period of emotional adjustment. Closing. Now let's hear from an expert in the field. Welcome, doctor. Can you tell us who makes a good candidate for liposuction? Let's dive into the expert's perspective. Hello everyone, a common query I encounter is about the ideal candidate for liposuction. Typically, this procedure suits those who are within a healthy weight range, but struggle with localized fat deposits that don't respond to diet or exercise. It's crucial, however, to have a clear understanding and realistic expectations. Liposuction is not a weight loss solution, it's a body contouring tool. This insight underscores the importance of a balanced perspective when considering liposuction. It's not a magic wand, but a surgical procedure aimed at enhancing your body shape by targeting stubborn fat pockets. Thank you, doctor. Now, let's talk about the cost of liposuction. Stay tuned as we delve into the financial aspects of this popular cosmetic procedure in our next segment. Now let's address the question on everyone's mind. How much does liposuction cost? Well, the price tag can vary quite a bit. The total cost of liposuction is influenced by several key factors. For starters, the surgeon's experience plays a crucial role. More seasoned surgeons with a proven track record of success typically charge more. Next, the geographical location of the clinic can impact the cost. Procedures in urban areas or cosmopolitan cities usually carry a higher price due to the higher cost of living. Finally, the scope of the procedure itself can influence the final bill. Larger areas or multiple areas requiring liposuction will naturally cost more than smaller localized procedures. On average, you can expect liposuction to range from a few $1,000s to several thousand. Remember, it's essential to consider the surgeon's expertise and the potential outcome, not just the cost. That's all for today's video. Thanks for watching.